Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey, Public Health on Call listeners. This is producer Lindsay Smith-Rogers. Today, Stephanie Desmond talks to Dr. Gunhild Valdemar, a leading healthcare advocate for the elderly in Denmark, about the COVID-19 situation there. Denmark lifted all COVID restrictions in September after achieving high vaccination rates. They discuss how trust in the government is behind successes there and what the future may hold now that winter is again coming. Let's listen.
Gunhild Valdemar, thanks so much for joining me.
Well, thank you for inviting me.
So I wanted to talk to you about the COVID situation in your country of Denmark. I know that vaccination rates are high. I've heard as many as 80% or more of adults are vaccinated. You had upwards of 95% of people 50 and older fully vaccinated. And this led the country in late summer to ease some restrictions. Tell me why you think the country did so well back at that point.
Well, from my viewpoint, from the position as a leading healthcare person in Denmark, I would say that the success really comes from mass testing, vaccinations, as you already mentioned, a high rate, a high adherence to our restrictions, and also to policies, including Corona passports. And why did this happen? I think, first of all, there are a number of reasons, but first of all, we have a universal access to healthcare in Denmark, financed by taxes. And so going to the hospital, going to see a doctor is all free for everyone. And the healthcare system, particularly at the secondary healthcare, is very well coordinated at the national level and also at the regional level. And I think this helped us a lot when this happened unexpectedly, the situation with COVID-19. Second, Danes have a high degree of trust in health authorities and health experts, not only at the national level, but also at the local level. So there's a long tradition for having a high degree of trust. And then next, I would say that the authorities have been very consistent in all communications being transparent. All the way through the pandemic, they've been very open about bad news as well as good news and not trying to hide any news for people. So one might say that the authorities also have had a high degree of trust in the people of Denmark because they have trusted people to be responsible and to follow guidelines. And I think this is part of the secret why it has worked so well. Then it has been a policy, and I think there's been agreement about that more or less across political parties, not to mandate people to get vaccinated, not to force people to get vaccinated or to be tested. So there have been no penalties for not being tested or not being vaccinated, except, of course, during the restrictions, your freedom to move around was not so good if you were not tested. But for instance, you would not lose your job if you did not want to get tested or did not have a vaccination. So I think this voluntary basis, the transparent communication, the bilateral trust between the people and the authorities have been very important. And I also think that particularly our Danish health authorities and the Director General of our Danish health authority, Søren Brostrøm, has gone into this, has invested a lot of time personally and has become a very, very well-known profile during the whole COVID-19 pandemic with almost daily appearances on national media. And as he's a likable and very, very skilled person, I think this has also helped a lot. So there are several reasons that I think have contributed to the success. And of course, there was also a very quick lockdown in March of 2020 with quite extensive restrictions already from the very start. For instance, more restrictions than in our neighbor country, Sweden.
I think what you've just described is sort of the very opposite situation that we have here in the United States. There's not a lot of trust in government, not a lot of trust in the system. People don't support vaccines at as high a rate as they do in Denmark. When you look at what's happening here, what do you think?
Well, I think it's of course it can be explained, but it's so different from the reality here. And I think people here in Denmark, they have a hard time really believing what is happening, at least in some parts of your country. But still, then if we look at our own country again, we can also see there is a big variation. And I think this variation does just come across much more clear in the US. So, for instance, you mentioned we have a very high vaccination rate. At this moment, about 75.2% of our entire population, that's including children and everybody, have been vaccinated. But when looking at our 98 municipalities, local governments, this figure varies from 64% to 83%. So even with all these advantages that I mentioned before, we have these huge variations from one municipality to another. And that, again, there are many explanations for that, but some of it comes down to trust again, or mistrust, right? So it's mainly the very young people who, some of them seem not to like vaccinations, or they think it's not important. And it's also poorly integrated populations of ethnic minorities, typically living in the suburbs of our big cities, where for cultural reasons there are other beliefs about vaccination. So these are some of the factors that we have identified, but surely there are many other factors. And I think these factors probably have so much more significance in the US, that is such a huge country with such a wide variation in terms of culture and politics.
So in the late summer, your country determined that there was no longer a critical threat from COVID, and you eased many restrictions. And I understand that even in the past week or two, there's been an easing of travel restrictions to other countries, folks coming to you, you going to them. And I understand, though, that in the last few weeks, now you're seeing a rise in COVID cases that you haven't seen in a while.
Yes, we have.
And why do you think those two things are happening?
Well, I think, again, there are several reasons for that. It was such a relief for the whole population that the final restrictions disappeared on September 10th. That was a date that had been planned already a long time in advance, but of course it was dependent on how the infection rates would go. So since September 10th, the only restrictions have been relating to traveling to and from other countries, but not any internal restrictions yet. Big relief. And I think it was expected that infection rates would rise again during the fall here and then the winter time. And then in Denmark, we have a national holiday or week off here in week 42. It was 1 or 2 weeks, 2 weeks ago, where a lot of people go on holiday together, families come together and join. And that probably has also contributed to the rising rates now. But notably, the majority of people who go into hospitals are those who are not vaccinated. And those who are vaccinated seem to not get severe illness from it. But our authorities are now watching this very carefully. And the political pandemic committee that has been established a year ago will now rejoin and see what they can agree to do about this. At this moment, we have 255 in hospitals. When we had the worst second wave here, we were up at more than 1,000 people hospitalized. So we are not up there, but we would not like to go there again, of course. But as compared to the first and second wave, there are much fewer people in the intensive care units and needing ventilators, which is a good sign.
Do you see there becoming a push to reinstate some restrictions now that cases are rising again?
I don't think anyone knows right now. I mean, because this is not only a decision taken by the authorities, it is decisions about re-implementing and restrictions will also be a political decision that has to be negotiated between our political parties. So I'm not sure how this will end up. But it could, maybe what they will come up with is a requirement to show a corona passport again. A corona passport documenting that you are either vaccinated or have been tested within the past 48 or 72 hours, tested negative. So they may require that again in order for people to go to concerts or restaurants or even to school.
Do you think there would be pushback, or do you think that this would be accepted by the people as it was earlier, at earlier stages?
I would anticipate that this will be accepted again. As long as the communication is transparent, you're not forced to do it, and people still can trust the authorities. I think that is really the key thing.
So what you're saying is that this sort of groundwork of trust that was built for many, many years is what has really helped Denmark to so successfully handle the coronavirus.
Yeah, that's my personal opinion, that is probably the most important factor of all. But I also think that we have learned, even though we have been successful in many ways, I also think we have learned very important lessons during this pandemic. And that is the situation with our elderly people. As in other countries, the majority of people who passed away with COVID-19, they were elderly people, and the majority of them had dementia. So what we learned during this pandemic is just how vulnerable people with the severe brain disorder dementia are. In fact, 25% of people with confirmed COVID-19 infections living in nursing home passed away. So that's 25%. That should maybe be compared to, in the general population, less than 1% died from COVID-19. And if you take the whole elderly population, like above 70 years of age, it was around 9 or 10% who died with the infection. But in elderly people with dementia, it was 25%. And this corresponds very well with figures from other countries. So I think that we have to, a learning experience really is that nursing homes, they are homes for people who can no longer care for themselves. And they should be very good homes with very nice activities. But they are also an extended part of our healthcare system. And that part we probably have ignored too much in previous years. And we saw that very clearly during the pandemic. So there was not so much focus on distributing face masks or other protective things out to the nursing homes in the beginning. It was all distributed to the hospitals and to the staff of hospitals. So this delay had a high cost to it. And second, what we also realized is how important it is that staff working in nursing home, that they are trained not only to take good care of our loved ones, of the elderly people who live there, typically with dementia, but they are also well trained in terms of medical conditions and preventing infections, for instance. And as in many other countries, I believe in the US as well, there is a lack of workforce in Denmark, and particularly also in nursing homes. So this means that a significant part of staff there are untrained, uneducated, and on temporary jobs in the nursing homes. And we're not quite sure how many of them are vaccinated. So even though the permanent staff had a very high vaccination rate, close to 100%, because such a big fraction of the staff are there to help out in temporary jobs and without any education, then we're not quite sure how many of them had been vaccinated. And this probably also has contributed to the widespread COVID-19 infections in our nursing homes. So that was really a tragedy. Almost 1,000 people died in nursing homes. And during the worst month, in the beginning of January, there were days or weeks with 100. So this is a high figure in our country. And not only that, but prior to their death, they had lived very isolated because nursing homes had been closed. Visits were not allowed, or visits were only allowed from family caregivers taking place outdoors. And during wintertime, that of course was not so easy. Some of our nursing homes have small rooms where they have their own sort of terrace outside. And for those who were lucky enough to have such a room in a nursing home, their family could visit them outdoors on this terrace. But other than that, they could only see their family or communicate with them on iPads, for instance, which was, of course, also good. But so that is the next learning experience we got, just how vulnerable these people are to isolation, social isolation, even more than all of us were. These very fragile elderly people, they really suffer from social isolation.
Gunhild Valdemar, thank you so much for joining me.
You're welcome.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.